Hello and welcome everyone. My name is Dr. Manickam and I'm a pediatrician. I trained at Brown for medical school, Columbia for residency, and right now I'm at Children's Hospital Los Angeles where I'm specializing further in the neonatal ICU. And here are the top 5 things you should know before you bring your baby home. First is how often should they be eating? You might have noticed in the newborn nursery or in the NICU, they were feeding your baby every 2 to 3 hours, maybe 2 to 3 ounces. That should be the goal, the minimum that your baby should be eating at home. But you'll notice that your baby probably will be hungry a lot more often. You can feed your baby as often as you'd like and as much as you'd like. They will determine how much they need, whether that be your breastfeeding or if you're using formula. The second thing should be how often should they be peeing and pooping. It's really based on how old they are. So in the first 6 days, they should be having the same number of wet diapers as they are in terms of their age. So for example, if they're 4 days old, they should have at least 4 wet diapers during the day. If they're 5 days old, they should have at least 5 wet diapers during the day. Once you get above age like over 6 days, they should have over 6 wet diapers per day. And that's how you know they have enough and they're hydrated enough. For pooping, typically most babies poop after every meal, but every baby has a different pattern. As long as they're growing and they seem comfortable, there's nothing to worry about. Their stools should just be yellow, green, seedy in consistency. You get concerned if it's red, white, or black. That's the reason why you should go to your pediatrician. Number 3, a fever is an emergency. For babies who are less than 2 months old, their immune system isn't quite as strong. Then it's not fully developed. They haven't gotten their vaccines yet. So as a result, if you ever feel like your baby is not acting like themselves, they are more tired than usual, they're peeing less than usual, they're not eating as much as they usually do, take a temperature. The easiest way to take a temperature is just to put a thermometer underneath their armpit. If it's above 100.4 degrees Fahrenheit or 38 degrees Celsius, then you want to go to the emergency department. At the very least, call your pediatrician. They'll probably do a bunch of tests just to make sure they don't have a bacterial infection that could make them a lot more sick. Fourth, how often should you bathe your baby? You bathe your baby usually every other day. You can use a warm towel, warm wet towel, and just kind of rub them. The reason why you're only using a towel and not putting them into a body of water is because they still have that umbilical cord attached to their belly button. We need that to fall off. And that falls off usually anywhere from 10 to 14 days after they're born. Once that falls off, you can actually put them in a little bucket and then bathe them in that way. But until then, use that damp cloth just to clean them off so they can stay clean. And that brings me to the 5th thing that parents often ask us is how often should they bring them outside or see other people? And the answer again is in those first 2 months, because their immune system is not fully formed yet or still not at its full capacity. You want to make sure you only expose them to individuals that they need to be seen. So like family members, grandmas, grandparents, anyone you really want to see the baby, go ahead, just be judicious. And when they do go outside, they can go out anywhere they want. Just make sure you put a cover over them so they don't get direct sunlight. And they always should have an extra layer compared to what you're wearing. So if you're wearing a t-shirt, they should be wearing 2 layers of clothing and so forth. Just because their skin is still fragile and thin and they can't really keep their heat in quite as much as an adult would. Some important notes for you all to keep in mind as you look through our content. First, all the information that I share is my own clinical opinion and not reflective of any of the other institutions I was a part of before or are currently. Second is that all the information we share is for full-term babies who are born greater than 37 weeks and have no other medical abnormalities or medical issues. So make sure you talk to your pediatrician before implementing any of the tips that we talk about to make sure that they're tailored for your child. And lastly, for any medical professionals in the audience, if you have any other clarifications or advice you want us to include in our videos, please send us a direct message, email us. We're happy to include them as well. If you found the information we're giving helpful, please click that like and subscribe button, and hopefully we can help you raise the best and most healthy children. Take care.